Hi, Ouma. How are you?
Well, and you, Prof.
Good to meet and chat. And
Yes.
we're kind of going to wing it like last week. You're going to ask me some things, and I'm going to ask you some things.
Prof, every time when we get to sit down with the patient, they ask us in a simple term, what is cancer?
What is cancer? That's such a good question. So, when I debate with my kids, my youngest will always go, "We've all got it." And I think the thing is, cells are born, they live, they have baby cells. Okay, so they divide, and then some of them die. Some of my cells are there all the time, like a brain cells. That's where you got to look after them. So sometimes there's always one in the family. So you know that naughty, delinquent Tutsi child. So what happens is they have babies, and then they develop their own type of family. So the cell has now undergone change and is working not on what the mothership or the organ says, but it says, I'm doing my own thing. And you can get many different types. Like you can get just like casual thief baddies and then really baddies. So now what's happening is this little cell is having its own baby cells and it's doing its own thing. So it's not listening to what the body wants, and they get bigger and bigger and bigger, and then they want to spread. And cancer spread in one of two ways. So if you've got a cancer in the breast, okay, the breast is like a prison. And cancer in the breast is like sitting prisoners inside the prison. And what happens is the security guard, the main security guard is your glands under your arm. So that's like going out the front gate. But then there can be those really baddies that can dig underground and go in the blood vessels and other little areas so that you don't see them. Because people often ask me, why must I do other treatment if I've had my cancer cut out? And I always say that any cancer that's invading has the ability to send little terrorists elsewhere. So you're going to have some form of treatment for any invading cancer, whether it's hormonal treatment or chemo or targets, okay. And you can't replace one with another. The amount of times I get asked, if I take both my breasts off, then I'm not going to need chemo or radiation. That's absolute nonsense, okay.
The other question, Prof, when is the emergency? How do we know this is agent?
So the only emergency is getting people properly counseled. Really. The only emergency is saying to somebody, right, you need information so you make an informed consent. But otherwise there's no emergency. There are a couple of emergencies when cancers are spread, when people come in and they feel that they can't move their legs or they suddenly got bad headaches and can't see properly. Those are things that need to be dealt with. But being diagnosed with a cancer, no emergency. When we're talking about breast cancer, you take time, you get counseled, you get navigated, and whereas you can't change your diagnosis with anything, you can change your concept of informed consent. Informed consent is the knowledge you get from your navigators and your counselors and your doctors. Okay, Google. Okay, and your consent is you saying, hold on a minute, I have processed this and I now understand and I'm happy with that. And don't be scared to have 2, 3, 4 different opinions, speak to people, been through it. Be careful of anyone who promises the end of the earth. Always.